Dear viewers, this video is part 2 of the three-part series on WBCs, granulocytes, functional aspects in the Medicine for Anyone in the YouTube channel. With phagocytosis comes a burst of oxygen consumption. NADPH oxidase enzyme is assembled and catalyzes oxygen to superoxide anion, which is then converted by superoxide dismutase to hydrogen peroxide and other toxic oxygen products. Example, hydroxyl radical. Hydrogen peroxide plus chloride plus neutrophil myeloperoxidase generates hypochlorous acid, that is bleach, hypochlorite and chlorine. These products oxidize microorganisms and tumor cells. Strongly cationic proteins, defensins, elastase, cathepsins, and probably nitric oxide also participate in microbial killing. Lactoferrin chelates iron, an important growth factor for microorganisms, especially fungi. Other enzymes such as lysozyme and acid proteases help digest microbial debris. After 1 to 4 days in tissues, neutrophils die. Under certain conditions, such as in delayed type hypersensitivity, monocyte accumulation occurs within 6 to 12 hours of initiation of inflammation. Neutrophils, monocytes, microorganisms in various states of digestion and altered local tissue cells make up the inflammatory exudate known as pus. Myeloperoxidase confers the characteristic green color to pus and may participate in turning off the inflammatory process by inactivating chemoattractants and immobilizing phagocytic cells. Chemokines, that is chemoattractant cytokines, are small proteins produced by many different cell types, including endothelial cells, fibroblasts, epithelial cells, neutrophils, and monocytes that regulate neutrophil, monocyte, eosinophil, and lymphocyte recruitment and activation. Dear listeners, by the way, this educational video is made possible by Prescribe-On, the makers of e-prescription software for digital prescriptions available freely for doctors on the website www.prescribeon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Neutrophil abnormalities. Defects in the neutrophil life cycle can lead to dysfunction and compromised host defenses. When inflammation is severely depressed, the clinical result is often recurrent, severe bacterial and fungal infections. Aphthous ulcers of mucous membranes, that is grey ulcers without pus, and gingivitis and periodontal disease suggest a phagocytic cell disorder. Neutropenia. The consequences of absent neutrophils are dramatic. Susceptibility to infectious diseases increases sharply when neutrophil counts fall to below 1000 cells per microliter. When the absolute neutrophil count, ANC, band forms and mature neutrophils combined, fall to less than 500 cells per microliter, control of endogenous microbial flora, example mouth and gut, is impaired. When the ANC, absolute neutrophil count, is below 200 per microliter, the local inflammatory process is absent. Neutropenia can be due to depressed production, increased peripheral destruction, or excessive peripheral pooling, that is transient neutropenia, as in overwhelming bacterial infection, as in acute endotoxemia. Acute neutropenia, such as that caused by cancer chemotherapy, is more likely to be associated with increased risk of infection than chronic neutropenia, developing over months to years. The most common neutropenia are iatrogenic, resulting from the use of cytotoxic or immunosuppressive therapies for malignancies or control of autoimmune disorders. These drugs cause neutropenia because they result in decreased production of rapidly growing progenitor, that is stem cells of the marrow. Certain antibiotics such as chloramphenicol, trimethoprim sulfamethoxazole, vidarabine, and the antiretroviral drug zidovudine may cause neutropenia by inhibiting proliferation of myeloid precursors. The marrow suppression is generally dose-related and dependent on continued administration of the drug. Cessation of the offending agent and recombinant human GCSF, that is granulocyte colony stimulating factor, usually reverse these forms of neutropenia. Recombinant human GCSF. Granulocyte CSF is produced by monocytes and fibroblasts. It stimulates granulocyte colony formation, activates neutrophils, and differentiates certain myeloid leukemic cells. Recombinant granulocyte colony stimulating factor RGCSF is a glycoprotein hormone which has been produced in mammalian cells and in the bacterium E. coli, that is Escherichia coli, through recombinant DNA technology. Another important mechanism for iatrogenic neutropenia is the effect of drugs that serve as immune haptens and sensitive neutrophils or neutrophil precursors to immune-mediated peripheral destruction. This form of drug-induced neutropenia can be seen within 7 days of exposure to the drug. With previous drug exposure, resulting in pre-existing antibodies, neutropenia may occur a few hours after administration of the drug. Although any drug can cause this form of neutropenia, the most frequent causes are commonly used antibiotics such as sulfur-containing compounds, penicillin, and cephalosporins. Drug-induced neutropenia can be severe, but discontinuation of the sensitizing drug is sufficient for recovery, which is usually seen within 5 to 7 days and is complete by 10 days. Re-administration of the sensitizing drug should be avoided because abrupt neutropenia will often result. For this reason, diagnostic challenge should be avoided. Autoimmune neutropenias caused by circulating anti-neutrophil antibodies are another form of acquired neutropenia that results in increased destruction of neutrophils. Acquired neutropenia may also be seen with viral infections, including acute infection with HIV. Hereditary neutropenias. Hereditary neutropenias are rare and may manifest in early childhood as a profound constant neutropenia or a granulocytosis, that is, a deficiency of granulocytes in the blood, causing increased vulnerability to infection. Maternal factors can be associated with neutropenia in the newborn. Transplacental transfer of IgG directed against antigens on fetal neutrophils can result in peripheral destruction. Drugs, example thiazides, ingested during pregnancy can cause neutropenia in the newborn by either depressed production or peripheral destruction. Neutrophilia. Neutrophilia, that is increased numbers of neutrophils in blood, results from increased neutrophil production, increased marrow release, or defective margination. The most important acute causes of neutrophilia is infection. Neutrophilia from acute infection represents both increased production and increased marrow release. Increased production is also associated with chronic inflammation and certain myeloproliferative diseases, that is, increased numbers of cells produced by the bone marrow. Increased marrow release and mobilization of the marginated leukocyte pool are induced by glucocorticoids. Release of epinephrine, that is adrenaline, as with vigorous exercise, excitement, or stress, will demarginate neutrophils in the spleen and lungs and double the neutrophil count in minutes. Cigarette smoking can elevate neutrophil counts above the normal range. Leukocytosis with cell counts of 10 to 25,000 per microliter occurs in response to infection and other forms of acute inflammation and results from both release of the marginated pool and mobilization of marrow reserves. Persistent neutrophilia with cell counts of 30 to 50,000 per microliter is called a leukemoid reaction, a term often used to distinguish this degree of neutrophilia from leukemia. In a leukemoid reaction, the circulating neutrophils are usually mature and not clonally derived. Disorders of neutrophil granules. The most common neutrophil defect is myeloperoxidase deficiency, a primary granule defect inherited as an autosomal recessive trait caused by mutations in the MPO gene on chromosome 17. Note: autosomal means that a specific gene is not on a sex chromosome and is a numbered chromosome. Humans have 46 chromosomes. Each parent gives you 23 chromosomes via the egg, that is from mother, or sperm, that is from father, for a total of 46 chromosomes. There are 2 sex chromosomes, X and Y, and 22 numbered chromosomes from each parent. Recessive. This means both genes in a pair must be abnormal to cause disease. People with only one defective gene in the pair are called carriers. These people are most often not affected with the condition. However, they can pass the abnormal gene to their children. The incidence is about 1 in 2000 persons. Isolated myeloperoxidase deficiency is not associated with clinically compromised defenses, presumably because other defense systems such as hydrogen peroxide generation are amplified. Microbicidal activity of neutrophils is delayed but not absent. Mononuclear phagocytes. See figure genesis of white blood cells shown earlier. The mononuclear phagocyte system is composed of monoblasts, promonocytes, and monocytes, in addition to the structurally diverse tissue macrophages that make up what was previously referred to as the reticuloendothelial system. Macrophages are long-lived phagocytic cells capable of many of the functions of neutrophils. They are also secretory cells that participate in many immunologic and inflammatory processes distinct from neutrophils. Monocytes leave the circulation by diapedesis more slowly than neutrophils and have a half-life in the blood of 12 to 24 hours. Many tissue macrophages, so-called big eaters, arise even before hematopoiesis and take up residence in tissues. In addition, there are macrophages derived from monocytes, which may have specialized functions suited for specific anatomic locations. Macrophages are particularly abundant in capillary walls of the lung, spleen, liver, and bone marrow, where they function to remove microorganisms and other noxious elements from the blood. Alveolar macrophages, lungs, liver Kupffer cells, splenic macrophages, peritoneal macrophages, bone marrow macrophages, lymphatic macrophages, brain microglial cells, and dendritic macrophages all have specialized functions. Note: dendritic macrophages, dendritic cells are found in tissue that has contact with the outside environment, such as lung mucosa, epithelial cells of the skin, and the linings of the nose and the gastrointestinal tract. Macrophage secreted products include lysozyme, neutral proteases, acid hydrolases, arginase, complement components, binding proteins, transferrin, fibronectin, transcobalamin 2, nucleosides, and cytokines like TNF alpha, IL-1, 8, 12 and 18. IL-1 has many functions including initiating fever in the hypothalamus, mobilizing leukocytes from the bone marrow, and activating lymphocytes and neutrophils. TNF alpha is a pyrogen that duplicates many of the actions of IL-1 and plays an important role in the pathogenesis of gram-negative shock. TNF alpha stimulates production of hydrogen peroxide and related toxic oxygen species by macrophages and neutrophils. In addition, TNF alpha induces catabolic changes that contribute to the profound wasting, that is cachexia, associated with many chronic diseases. Other macrophage secreted products include reactive oxygen and nitrogen metabolites, bioactive lipids like arachidonic acid metabolites and platelet activating factors, chemokines, colony stimulating factors, and factors stimulating fibroblast and vessel proliferation. Macrophages help regulate the replication of lymphocytes and participate in the killing of tumors, viruses, and certain bacteria like Mycobacterium tuberculosis and Listeria monocytogenes. Macrophages are key effector cells in the elimination of intracellular microorganisms. Their ability to fuse to form giant cells that coalesce into granulomas in response to some inflammatory stimuli is important in the elimination of intracellular microbes and is under the control of IFN gamma. Nitric oxide induced by IFN gamma may be an important effector against intracellular parasites, including tuberculosis and leishmania. Macrophages play an important role in the immune response. They process and present antigen to lymphocytes and secrete cytokines that modulate and direct lymphocyte development and function. Macrophages participate in autoimmune phenomena by removing immune complexes and other substances from the circulation. In wound healing, they dispose of senescent cells and they also contribute to atheroma development. Macrophage elastase mediates development of emphysema from cigarette smoking. So, dear viewers, this is the end of part 2 of the 3-part series on WBCs, granulocytes, functional aspects in the Medicine for Anyone in the YouTube channel. Thank you for watching the video.